Look at Ashton.
Ready?
Yeah.
Okay. When you think of being a nurse, most people think about changing people and cleaning up after people. Although that is a lot of the job, there's much more into it than that. If you look up the definition of being a nurse in the dictionary, it's simply put as a person trained to care for sick or infirm people. However, the American Nursing Association puts the definition more in depth, which is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through diagnosis, treatment of human response, and advocacy of care of individuals, families, groups, and communities. So my name is Cheyenne. I'm just going to let you know today about the job description of being a nurse, the pros and cons of the job, and also ways to become a nurse. And a little background about myself: I am not a nurse. However, I'm a nursing student going to school right now. Hopefully someday soon in the near future I will be a nurse. However, I am a medic in the military and have had the opportunity to train and work alongside nurses, and I'm also qualified, being in the military, qualified to do the job of a nurse and even more than what they can do. So that's a pro to the job. So the description of a nurse: basically a nurse is just there for the patients. Some of the tasks that nurses do is give meds, wound care, give education and advice on health. So most patients being seen by a nurse are there for issues that they're not happy about. So more often than not, the frustration is put out on the nurse. So nurses play a huge role in keeping the patients calm, comfortable, and getting them out of there as quickly as possible. Ways to become a nurse: well, education experience is key. There's many levels, and they all require a certain license and education experience, basically. And there's also many programs available, from undergraduate, graduate, all the way up to DNP, which is a Doctor of Nursing Practice. The pros of the job: there's always new things coming up, always new issues with patients, just like the mechanic's job. You get a car, you're going to figure out, okay, this is what's going on with it, so this is how we're going to treat it, this is how we're going to fix it. Just like a nurse, you're going to get a patient saying this, this, and that, so we're going to treat it like that. So kind of the same as being a mechanic, like the job that you guys are in. It's also a constant learning experience. So like I said, there's always new issues coming up. An advantage to the job that I find as an advantage is the shift work. You can work for about 12 hours on and then 2 or 3 days off. So that's an advantage to me, which makes them as a disadvantage to a lot of other people. And lastly, there's also many areas to work in, with pediatrics, which is children, geriatrics, which is old people, bariatrics, overweight people, and cancer patients, and many other areas. Some disadvantages to the job would be the shift work, although I find it as an advantage. Some people might not like that. Some people might want to be on a set schedule. The physical demands is also a con to the job. You might have to lift those heavy patients, pick up their legs to do exams, and sometimes those legs can weigh as much as 50 to 100 pounds, depending on how big the patients are. Another disadvantage to the job is the attachment that you do get to your patients. You do come across a lot of loss in the nursing field, and also it's just hard to not be able to treat a patient depending on how severe their condition is. And then the last disadvantage to the job is the hazard of being exposed constantly to sick people, always having that chance of getting sick and having what the patient has, so that's also a disadvantage. So basically, you guys all have a general idea about the job of being a nurse, and the pros and cons, and the ways to become a nurse. So just keep in mind, nursing isn't for everybody, but it has many benefits and is very an educational career. And that's it.
Why keep Bohlman registered nurse for the state?